A very good morning to everyone. Today we have a demo of the back of the scapula or the scapular region. So for that we have to remove this skin. So we have to keep the first point at the C7 spinous process, second point near the T12 spinous process, and we will make an incision from first point till the second point, and again another incision from the T12 spinous process till the mid axillary line towards the anterior abdominal wall. Now the second incision from the C7 spinous process till the acromion process of the scapula. Now we will do the diagonal incision from the T12 spinous process till the posterior axillary wall, and we will put a little bit incision towards the posterior part of the arm region. Somehow let us reflect this the skin, and after reflecting the skin we can see the superficial muscles, that is trapezius and the latissimus dorsi. This diamond shape muscles you can see over here, this diamond shape, that is known as the trapezius muscles. Now let us know about the origin, insertion, nerve supply and action of the trapezius. Correlate with the diagram. Origin takes place from the middle 1/3 of superior nuchal line, external occipital protuberance, ligamentum nuchae, spine of C7 vertebra, as well as spine of all the thoracic vertebra, that is from T1 to till T12 vertebra. So now we have to know about three fibers of the trapezius. So upper fibers goes and attach to the lateral 1/3 of the clavicle, which helps in elevation of the scapula. Same how we have this is spinous process. So the upper middle fibers goes and attach to the medial margin of the acromion process, and it also helps in the retraction of the scapula. Same how we have the lower fibers which goes and attach to the superior margin of spine of the scapula as well as to the deltoid tubercle. It helps in depression of the scapula. So we have to know about the nerve supply of the trapezius as well as other muscles deep to the trapezius. So for that we have to cut the trapezius muscles from its origin, and we will reflect it. Can see here just deep to the trapezius you can see the neurovascular bundle, and the nerve which you can see here, that is known as the spinal axillary nerve, which is supplying the trapezius, and superficial branch of transverse cervical artery. So we have to know the muscles which is deep to the trapezius. Correlate with the diagram. This is known as levator scapulae muscles, and the origin of this levator scapulae muscles takes place from the transverse process of C1, C2, C3 and the C4 vertebra, and it goes and attached to the upper part of medial margin of the scapula, and it helps in elevation of the scapula as well as it is supplied by the dorsal scapular nerve. So this is about origin, insertion, nerve supply, action of the levator scapulae. Just below that we can see the muscles over here. This is known as rhomboideus minor muscles, and the origin of this rhomboideus minor muscles takes place from a little part from the ligamentum nuchae, from the spinous process of the C7 as well as T1 vertebra, and it goes and attached near the root of the spinous process of the scapula, that is near the medial margin of the border of the scapula. Same how it helps in the retraction of the scapula supplied by the dorsal scapular nerve. The next muscles is known as the rhomboideus major muscle. So origin takes place from the T2, T3, T4 and T5, the spinous process of thoracic vertebra, and it is inserted into the medial border of scapula from the root of the spinous process to the inferior angle of the scapula. It is supplied by dorsal scapular nerve and also helps in retraction, medial rotation and elevation of the scapula. Now let us recap all those muscles. So we have the huge muscles over here. This is the trapezius, and we have this is known as levator scapulae, rhomboideus minor, and this is known as rhomboideus major. Can you see this is known as the spinous process of the scapula? Just above this spinous process there is a muscle known as supraspinatus. Origin is from the supraspinous fossa, and it is inserted on the upper impression of greater tubercle of the humerus, supplied by suprascapular nerve, helps in 0 to 15 degree abduction of the shoulder joint. Correlate with the diagram. Same as just below the spinous process, this muscle is known as infraspinatus muscle. Origin is from the infraspinous fossa, and it is inserted onto the middle impression of the greater tubercle of the humerus, supplied by suprascapular nerve, helps in abduction of shoulder joint. This is known as the teres minor muscle. The origin is from the upper 2/3 of lateral border of the scapula, and it is inserted on the lower impression of the greater tubercle of the humerus. It is supplied by axillary nerve, and it helps in lateral rotation of the shoulder joint. Somehow just below this teres minor we have the teres major over here, and it is originated from the lateral border of the scapula just below the teres minor, and it is inserted on the medial lip of bicipital groove of the humerus. It is supplied by lower subscapular nerve, and it helps in medial rotation of the arm region. Below you can see the huge muscle. This is latissimus dorsi. So origin is from the spine of lower 6 thoracic vertebra, thoracolumbar fascia, outer lip of posterior part of iliac crest, lower 4 ribs and inferior angle of the scapula. It is inserted into the floor of the bicipital groove of the humerus, and it is supplied by thoracodorsal nerve, also known as swimmer's muscles, and it helps in adduction, extension and medial rotation of the arm. So let's recap the remaining muscles over here. So the muscles you can see, this is latissimus dorsi, and above we have the muscles known as supraspinatus, infraspinatus. This is teres minor muscles, while this is known as teres major muscles. Thank you.